Hey guys, welcome back to another video. So this is part 2 of the previous railway pharmacist question paper. Let's see the 36th question, which is the immunity that the body gets after the first attack of disease. It is called acquired immunity. Option D is the right answer. 37th question. The cells that are responsible for the production of antibodies are, what are those called? They are called as WBCs, that is white blood cells. A healthy person can donate blood how many times a year? Option C, 3 or 4 times a year. Next, radioactive cobalt and radium are used for the treatment of which disease? For the treatment of cancer. Option C. 40th question. World Health Day is on. Which day is it? It is on April 7th. Option B. Next one. To relieve from dyspnea. What is dyspnea? Dyspnea is basically shortness of breath. The appropriate position to be used is Fowler's position. Option D. It is not Fowler, it is Fowler's position. Where the patient is at a 45 to 60 degree. Patient sits in that position. It is a semi-sitting position. Next one. Protein requirement for a pregnant woman per day is how many grams? The right answer is 55 grams. The fundus is at the level of umbilicus during which week of pregnancy? So the correct answer is 24 weeks. Option C. 44th question. Total weight gain during pregnancy is, correct answer is option C, 13 to 14 kgs. The birth weight of the baby doubles at the age of 6 months. Option B. Next one. Infancy period is from, this can be a little bit confusing, but the correct answer here is 1 month to 1 year. Option B. The following are the signs of dehydration except, so you can see the options here. The correct answer here is option C, diuresis. What is diuresis? It means kidneys filter too much bodily fluid. It is, there is extra urine filtered out. Next one. The following are the contents of ORS, except, so it contains sodium chloride, sugar and potassium chloride, not calcium carbonate. So the right answer is option D, calcium carbonate. Next one. The most common form of malnutrition are the following except which one? Correct answer is option A, beriberi. The first course of oral pills should be started on the which day of menstrual cycle? Correct answer is option C, 5th day. The following are the natural method of contraception except, right answer is option A, foam tablet. Next one. Which is the permanent method of sterilization? Right answer is option C, tubectomy. So in this, the fallopian tubes are cut out. It is a permanent method to prevent pregnancy in females. Next. The following organs are situated in the abdominal cavity except, it's an easy question, esophagus or the food pipe. 54th question. The system of body which helps for removal of waste matter from body is the excretory system. Option D is the right answer. The total number of bones in the human body is option B, 206. Next, eruption of teeth starts at the age of which month? The correct answer is option B, 6 months. The nerve, it is nerve which carries messages from the brain and spinal cord muscles and glands is. So which is the right answer here? It is motor nerve. Speech center is situated in the parietal lobe. Option A. Largest gland in the body is, it is the liver. Option C. 60th question. Head control of the infant occurs at the age of which month? It is the 5th month. Option C. Puerperium is the period begins. So it is basically the postpartum period. Correct answer is option A. As soon as the placenta is expelled and lasts for 6 to 8 weeks. That is after childbirth, the period that is 6 weeks after childbirth. The postpartum. Next, when the umbilical cord lies in front of the presenting part and the membranes are intact, it is known as option B, cord presentation. Starting of menstrual cycle is called option C, menarche. Normal blood urea level is, right answer is option B, 20 to 40 mg%. 1 gram of carbohydrate yields how many calories? It yields 4 calories. A method of making the victim to breathe passively is option A, artificial respiration. Minute thin-walled blood vessels between the ends of arteries and beginning of veins is called, correct answer is capillaries. Next one, a waste gas produced by the body and exhaled through the lungs is, right answer is carbon dioxide. Option A. A condition characterized by moving of bonds of joint is dislocation. Option D. 70th question. A tube of muscular tissue carrying ingested food from the mouth to stomach is, it's very easy, it is esophagus or the food pipe. A red pigment in the blood cells which combines with oxygen and carbon dioxide for carrying them is option B, hemoglobin. Information given by the sufferer about his illness is option B, symptoms. Normal respiratory rate in adults is 16 to 20 minutes. Option C. The normal body temperature is 37 degrees Celsius. Characteristic of the blood flow due to arterial bleeding is the following except dark red in color. It is the right answer. An agent that has power to kill microorganism is bactericide. Side means killing. Strength of Savlon for cleaning of wounds is 1:10. Option A. Inflammation of the tongue is glossitis. Following are the predisposing cause for bed sore except which one? Anorexia. It is an eating disorder.